Welcome, and thank you for joining us. This module is all about norovirus and why it's in school cafeterias. We will discuss some examples from the past and from other states of problems seen with norovirus in school cafeterias. This module will provide 1 hour of continuing education for the North Carolina Department of Public Instruction in the School Nutrition Key Area of Operations, Area of General Food Safety. Norovirus is a type of foodborne illness. It is a virus which makes it a little different from some of the other foodborne illness-causing bugs like Salmonella, E. coli, and Campylobacter. These are bacteria which can grow in the environment under the right conditions. We know that bacteria don't like to grow in high-acid foods. If the conditions are right, one bacterial cell can multiply into billions of cells in 4 to 6 hours. Viruses are different. In fact, scientists aren't clear on whether or not viruses are alive. We can see bacterial cells, but viruses need a host to grow and reproduce. They are the simplest form, a shell that protects DNA, which is the genetic material that makes up all living things. Humans, plants, and animals, as well as bacteria, have DNA and other things to help them grow and survive. But viruses only have DNA. Norovirus, which is also known as Norwalk or Norwalk-like virus, is actually a large category of viruses. As we learn more about what causes foodborne illness, we have found that there are some viruses that look very similar and have similar DNA. We have classified this large group of illness-causing viruses as norovirus. The first outbreak that was identified from this foodborne pathogen happened in Norwalk, Ohio in 1975. This type of virus had never been seen before because scientists didn't have the technological capabilities to look at viruses this small until the 1970s. This is how it got the name Norwalk virus. Not only does norovirus cause gastrointestinal illness, norovirus, it is the leading cause of gastrointestinal but in other parts of the world, it is also called winter vomiting disease. We refer to it as norovirus or Norwalk virus. It is the class of virus that in other parts of the world causes gastrointestinal vomiting disease. It is the leading cause of gastrointestinal viruses most commonly associated with cruise ships. We see a lot of outbreaks. There tend to be more cases of norovirus at the tail end of winter. When people take their spring break vacations. We see a lot of outbreaks associated with norovirus around times when people take their spring break vacations. Norovirus may also be called the stomach flu, but the term flu comes from influenza, which is a respiratory virus. Respiratory viruses attack your airways, lungs, nose, and throat. Norovirus is not respiratory and only affects the intestines and stomach. The stomach flu is not a true influenza, unlike bird flu or avian influenza that you may have heard about in the news recently. An important characteristic of viruses is that they are very, very, very small. If you put 1 billion virus particles all together, it would not be visible to human eyes. This is why we didn't know much about them until about 40 years ago. If you have taken ServSafe, NC Safe Plates, or any other food handler training program, these symptoms may look familiar. Symptoms of norovirus are nausea, diarrhea, stomach cramps, chills, fatigue, and head and/or muscle aches. Fever is also a symptom. It is generally more of a low-grade fever and would not usually be high enough to cause great concern, yet it is still an indication of the virus. People who have had norovirus before describe it as one of the worst feelings they have ever experienced. Of the other foodborne illnesses, you are likely to feel the worst with norovirus, even though it only lasts a short time. Symptoms usually last for about 2 to 3 days, but are very severe. Symptoms may be more severe and complications more likely in young children, the elderly, pregnant women, or others with compromised immune systems, such as someone who has cancer or is being treated with antibiotics. In a school system, it is important to think about children and how they might be affected. Although norovirus is very common and symptoms are severe, most people get over the illness and there are relatively few hospitalizations. Although they are uncommon, there are between 30 and 100 deaths from norovirus each year in the U.S. Nearly all, around 99% in the past 10 years, are linked to elderly adults, usually in long-term care facilities. Norovirus is different than other types of food poisoning in terms of how long it takes symptoms to show up after a person is exposed to the virus. After the virus gets into the body, either by inhaling or ingesting it through the nose or mouth, it usually takes 24 to 48 hours to show symptoms, depending on how healthy the person is and how much virus they are exposed to. The cause is not usually one of the last meals that the person ate, because it takes a while for symptoms to develop. The virus needs time to get into the host's cells and use their machinery to make more virus particles. This picture is used to illustrate a very interesting point about norovirus. Even when the symptoms of norovirus are over, the virus particles can still be shed by that person in vomit, diarrhea, or through normal bowel movements, feces or poop, for up to 14 days after they were first exposed. By this point, the virus may be in lower concentrations, but it is still there. The biggest issue we see in food handling is with people who worked while being sick, from a norovirus standpoint, or with food handlers that came to work too early after having a gastrointestinal illness linked to norovirus. Just because the symptoms are over doesn't mean the person is clear of the virus. It still requires a lot of very good personal hygiene and hand washing, because the person may still be producing virus particles in their body and shedding them into the environment, even though the particles are in smaller amounts. We know that for every 10 people that have norovirus symptoms, there are likely 3 or 4 other people who have been exposed to the virus but do not have symptoms. We call this asymptomatic. But in the first 3 days after being exposed to norovirus, they are very actively shedding tens or hundreds of billions of virus particles. This is important because a very small amount, as few as 18 particles, on your food or your hands can make you sick. The amount of virus particles that fit on the head of a pin would be enough to infect more than 1,000 people. We can't see norovirus, it's very small, and it only takes a few particles to make someone sick. Once they are sick, they are generating billions of virus particles, which could then infect others. It has been described as the perfect human pathogen by the Centers for Disease Control and Prevention, which is the federal agency that handles outbreaks and focuses on human health. It is truly a very fascinating bug and illness, and the reason why we have so many issues in schools. This picture of a dining room is to illustrate some of the other challenges we have with norovirus. Looking at the right-hand side of the photo, imagine that the restaurant is packed and that every seat is filled. At the very back table, next to the window, a customer is eating his or her meal, but is starting to feel a little ill and nauseous, so much so that they are too overcome with illness to make it to the restroom on the far left side of the picture before vomiting. Imagine the person getting quickly up from the table and beginning to rush to the restroom, only getting halfway there before they vomit. Imagine that this person is ill from norovirus. In this exact situation, in this exact restaurant, remembering that every seat is filled, the likelihood of anyone sitting on the far right-hand side of this picture getting sick is about 90%. One of the most interesting features of this virus and illness is that because it is so small and because it causes people to vomit very forcefully, called projectile vomit, the vomit particles will aerosolize. This means that they essentially become vapor and can float in the air. The aerosolized particles will even be able to reach the people on the far left-hand side of the picture, including the people in the back, by the picture on the wall. Someone sitting at that table has a 10 to 20% likelihood of getting sick just because someone 40 to 50 feet away vomited. The fact that norovirus is so small, so potent, and can move quickly is very problematic in schools. It means that every vomit event that happens that is linked to norovirus has the chance to infect hundreds of people because of how the virus will spread throughout the air. Hopefully this example didn't make you too afraid of norovirus, but it is important to understand just how big of a problem it can be in schools. There is no vaccine or drug available to treat norovirus. Symptoms generally go away on their own, so norovirus is what we call a self-limiting ailment. Healthcare providers, as well as the science, tell us that the only thing we can do is stay hydrated. Antibiotics are not effective against norovirus. The biggest risk is from losing lots of fluids through vomiting and diarrhea, combined with not being able to keep fluids down. This leads to dehydration. In some severe cases, IV fluid treatment is necessary to replenish fluids because the stomach is so irritated from the virus that the person cannot even tolerate drinking water. Now that you have some scientific background on norovirus, we will talk about some real situations involving norovirus events. A norovirus outbreak in 2014 in Asheville, North Carolina, left 160 students ill at an elementary and a high school. There were some common events that the elementary students participated in at the high school. Officials believe that one of the younger students attending a concert in one of the rooms at the high school vomited, and it was thought to be norovirus. By the end of this outbreak, which lasted several weeks, over 160 students were sick. This is our biggest problem when it comes to schools. We have ill students that come to school because parents may not be able to get childcare for them, or the student might be feeling okay but not have fully recovered. Norovirus spreads extremely quickly throughout the school population. One thing that becomes very important and that sometimes falls outside of our roles in cafeterias and school food service is cleaning and sanitizing around the schools and in the cafeteria. This can contribute to limiting an outbreak and its impact if done right. In January 2015, there were norovirus outbreaks at 6 different colleges. It was thought that the virus was spread through food because in all of these colleges, eating food from the cafeteria was seen as a risk factor for getting sick. An outbreak at Longwood University in Farmville, Virginia, caused about 3 dozen cases of norovirus and happened after a similar outbreak at Hampden-Sydney College, where there were about 300 cases. Some students from Longwood University had traveled to Hampden-Sydney for a fraternity-sorority event, and it was thought that those individuals introduced it to Longwood University. Norovirus outbreaks are so common that it is hard to go 1 week without coming across news of one. The ones we hear about are most often linked to restaurants, senior centers, long-term care facilities, schools, and cruise ships. Restaurants are by far the largest source of norovirus outbreaks, but school cafeterias fall into this food service industry too. Norovirus is very common. There are an estimated 48 billion cases of foodborne illness in the U.S. each year. Between 5 and 8 million of these cases are likely to be confirmed norovirus-related illnesses. Another 5.5 million are not confirmed, but are likely to be caused by norovirus, so the total amount is nearly double the confirmed cases, at around 10 million. Norovirus is the second leading cause of food-related hospitalizations, behind Salmonella. On a relative scale, there are many cases of norovirus, but few hospitalizations. However, those hospitalizations still make a big impact on our healthcare situation. Thinking about a school setting with, on average, hundreds to thousands of students, if 1 in 15 were to get norovirus and it was not managed well and the students are exposed, it can become a very big problem. The cost of norovirus in our country is about $2.5 to $3.5 billion each year in lost wages, lost work or productivity, child care costs, and healthcare costs. This economic impact is one of the reasons why we are focusing on preventing norovirus outbreaks. As we have mentioned before, it is very easy to spread norovirus from person to person. If you have had previous food handler training, you may remember learning about the fecal-oral route of transmission. Norovirus is transmitted through this fecal-oral or vomitous-oral route, which means that everyone who you know who has had norovirus had some sort of vomit or feces that they picked up on their hands or was on their food and then got into their mouth. That is the only way to get norovirus. You can't get it by touching it. It isn't absorbed through the skin. It will only go through the mouth. Although it is often passed through contaminated water or food, hand transmission or person-to-person transmission is a major source of norovirus transmission. A previous outbreak of norovirus in Raleigh, North Carolina, was linked to shellfish, specifically steamed oysters, at a popular restaurant called 42nd Street Oyster Bar. Over 400 people got sick from that outbreak over a week and a half. In the school setting, oysters aren't served very often, but 2 outbreaks we will discuss now show that it isn't always the food itself that can cause the virus to spread so quickly. At the time of the 42nd Street Oyster Bar outbreak, another Raleigh restaurant had a smaller norovirus outbreak, leaving about 50 people ill. This outbreak was linked to attending a catered Rotary event at the Angus Barn restaurant. During the investigation of that outbreak, public health officials interviewed managers, employees, and customers, took samples of the food, and tested fecal samples to see whether there were common foods or other links between the 2 outbreaks. None of the employees had symptoms of norovirus, and their stool samples were negative. The food used at the Rotary event was also served in the lunch buffet at the restaurant, but no one who ate at the buffet became sick. The only common factor between those who got sick seemed to be that they had all shaken hands with others at the event, so the best guess was that the virus was transmitted by hand-to-hand contact. Attendees weren't always using utensils when handling food, so by shaking hands, touching the food, and then putting it in their mouths, they became exposed to the virus. Another outbreak occurred among players of the San Diego State basketball team during the 2015 March Madness tournament. After losing in a game against Duke University, their coach told reporters that one of their star players and 4 of their other players were thought to have norovirus. This may not be why they lost the game, but we often see norovirus outbreaks linked to sports. Teammates change together, high-five each other, and use common showers, but there isn't a lot of cleaning and sanitizing. This may happen in high school sports as well as the collegiate level and professional level. Because hand-to-hand contact also spreads norovirus, it is often hard to differentiate hand-to-hand contact transmission from other sources of transmission. Once norovirus is outside of the human body, such as when someone vomits or through fecal matter, it can survive extremely well, for at least 2 weeks. It survives especially well in colder weather with low humidity, which are typical winter conditions. It has been shown to live on surfaces such as tables, cafeteria trays, and chairs for up to 6 weeks. It also survives well in water for up to 2 months. This is why cleaning and sanitizing is so important. You can't see the particles, it spreads quickly, and it is very stable and can survive for a long time in the environment. NC State has recently conducted some research on vomit. A graduate student developed a vomit machine to study how far actual vomit material, not just the aerosolized spray, from someone with norovirus can travel. The student found that vomit can travel up to a 15-foot radius from the visible vomit area. If someone vomits in a cafeteria or restroom, imagine how much virus would be out there and how much of a problem it would be. Because it is extremely hardy, surface disinfection is crucial. If you know that norovirus illnesses are happening at the school, even if there isn't a confirmed outbreak, or that there is evidence of gastrointestinal illness, it is very important to clean and sanitize anything coming into or out of the kitchen. Although this may be the responsibility of the janitorial staff, you may have more information about norovirus than they do, so it is a good time to talk to them about cleaning and sanitizing. Cleaning and sanitizing with norovirus is special. Quaternary cleaners, which many of you may be currently using, are not effective against norovirus. Only bleach-based sanitizers are effective against norovirus. However, it is important to know that bleach-based sanitizers do not work well if applied to dirt or soil. This is why cleaning and sanitizing is a two-step process, especially for norovirus. Surfaces must be cleaned to remove dirt before they can be effectively sanitized. We have seen multiple outbreaks linked to common food lines and eating areas. The most important points to remember are that norovirus is very infectious, it only takes a few particles to cause illness, is very common in these areas, and can live on surfaces for long periods of time. What are our prevention strategies? The HACCP plan, which is in line with the North Carolina Food Code, recommends the exclusion of sick food handlers. Employees may still be infectious even if they don't show symptoms, and employees showing symptoms can remain infectious for up to 72 hours after symptoms subside. It is important that employees who have been sick are excluded from food preparation while they are ill. We suggest, based on what the science says, that they should be excluded from food preparation and any hand contact with food for at least 72 hours after getting better, although the HACCP plan says 48 hours. This will greatly reduce the risk of transmission because they are still shedding the virus at such a high rate. Over the past 10 years in the U.S., roughly 200 or 300 norovirus outbreaks have been specifically linked to someone handling food while ill. This next outbreak is an example of the worst case scenario. About 10 years ago, a cook in a Michigan restaurant came to work and reported to the kitchen manager having symptoms of gastrointestinal illness, specifically vomiting and diarrhea. The employee told the manager that even though they were short-staffed, he or she would have to go home. However, the kitchen manager said that they were so short, if the cook went home, they would have to close the restaurant, and threatened to fire the employee if he or she left. The cook was put in a bad situation. Not only was the cook not feeling well, but was now at risk of losing his or her job. The cook stayed and continued to work while being sick. At least twice while preparing food in the kitchen, the cook reported vomiting in a garbage can in the kitchen. It may not surprise you that over 600 people got sick from food prepared in that kitchen over the next 2 days because the employee wasn't allowed to go home. The critical message for you, your colleagues, and your staff is that if someone has gastrointestinal illness, they can't be around. There is too much potential for students and others at the school to be exposed to the virus. If you think that food has come in contact with norovirus or with someone that has norovirus, it is important to also dispose of it. We see this in a case where someone may have been prepping food on, say, a Thursday afternoon for service on Friday, and then calls in Friday morning. The worker reports not feeling well when going home Thursday and symptoms of gastrointestinal illness, and that they are not coming to work that day. You may want to look at the foods this person was prepping as something that is a loss from that day before, especially if there is the potential it could have been contaminated. If you have already viewed the module on hand washing, you may recall that alcohol-based hand sanitizer is not effective against norovirus. Often what we see in school-based outbreaks is public health and school administrators acknowledging that the outbreak is going on and that they are on high alert and encouraging people to use hand sanitizer as a way to control the virus. This is not a good control measure because we know that hand sanitizers do not work at all against norovirus. It is really just spreading the virus around. Soap and water, however, will work for cleaning hands. On surfaces, only a bleach solution will kill norovirus. Commercial products like Lysol or Clorox wipes are not chlorine-based. Instead, they are quaternary ammonium-based and will not work on norovirus. For normal day-to-day sanitizing, quaternary ammonium compounds are fantastic. They are very active against most pathogens. The compound sticks around for a while and doesn't lose its effectiveness after opening the bottle. Chlorine-based sanitizers, on the other hand, made from diluting the concentrated chemical, start to lose their effectiveness after about 24 hours, but it's the only thing you can use against norovirus. If you are in a kitchen or cafeteria setting where there has been a vomiting event, personal protective equipment, including gloves, face masks, and smocks or aprons that cover clothing, are advised by the Center for Disease Control and Prevention. These tools are extremely important in preventing the spread of norovirus, especially if you are involved in cleaning up after the event. The CDC also suggests that you must clean up the vomit first and then sanitize afterwards. Cleaning is using an absorbent powder to get rid of any debris and soil. Afterwards, in that 15-foot radius around the event, use a chlorine-based sanitizer. You will need to prepare a fresh bleach solution. The recommended dilution is between 1 to 10 and 1 to 50. If it is for a vomiting event, 1 to 10 is needed. If it is for cleaning a cafeteria or eating area where you know your school is going through a norovirus outbreak, or there have been confirmed cases, then you will need a 1 to 50 dilution. Having the correct concentration is critical. There is a tendency to overuse chlorine, especially when it is not used very often. Using too much or a higher concentration, such as a 1 to 5 dilution or a 1 to 1, as when pouring straight from the bottle, is not as effective as a 1 to 10 dilution because it changes the acidity of the sanitizer. Too much or too little will not work against norovirus. The right amount of contact time is also important when cleaning and sanitizing to prevent norovirus. Chlorine needs between 4 and 5 minutes of a sanitizer step. You will need to put it down and let it sit. There is a potential danger with using these sanitizing compounds. If for some reason you confuse quaternary sanitizer with the chlorine one and they get mixed together, or you use one right after the other and they get mixed together, it can create a very harmful chlorine dioxide gas that is toxic. You must keep your quaternary and chlorine bleach separate and away from each other, and do not let them mix. To summarize this module, It only takes 1 to 10 virus particles to cause illness. There are billions of virus particles from each poop or vomit event from someone who is sick or from someone who is not sick but who may be a carrier for norovirus. A great example comes from one outbreak in North Carolina where an individual who was not ill but was caring for an ill child and ill parents suffering from norovirus caused an outbreak. This person handled food and likely became an asymptomatic carrier. The outbreak was only associated with the days that this individual had been working during the time when they were caring for sick family members. Even though someone isn't showing symptoms, they still shed the virus for at least 10 days and up to 14 days. It is important to exclude these individuals from food handling for at least 48 hours, but ideally 72 hours, because it is best practice. Hopefully this module did not scare you too much, but gave you a better awareness and understanding of what norovirus is and how to manage it in school systems. Feel free to contact Dr. Ben Chapman by email or phone if you have any questions. Thank you for viewing the module Norovirus and its importance in school cafeterias. We hope you will join us next time for another module on school food safety.